Hello, everyone. Dr. Siddiqui here. Today, I have joining me Dr. Pichardo.
Hello, thanks for having me this
Welcome.
morning.
Pleasure.
Thank you.
So, before we get started, can you share an interesting story with us?
I think with residency training, there's always kind of like peculiar things that may happen. I think the one that we kind of like stuck a little bit with me, which I was like an intern during my first year, was we were actually trying to manage a patient ICU with alcohol intoxication and having all this, findings of having liver, kidney failure, I mean, you name it. But what was interesting is that we were doing everything by the book as we supposed to, and the patient was not getting any better. So we actually had to dig in deeper, and through a security camera, we find out that this patient was actually ingesting all the Purell that was in the hand sanitizer that was attached in the wall on all the hallways in the hospital. And we are like, okay, so he's having his ethylene glycol, his alcohol fix by that. And we actually had to take some measures and kind of take that off from the wall. And it was kind of interesting experiencing that, because me, as coming from a different country back then, I was like, oh my, that's really does happen. People do the most unusual things. Those kind of things kind of happen sometimes during residency. I mean, we deal a lot, especially in your field, my field, we deal a lot with people suffering with chronic illnesses and addiction. And it's a huge, huge problem also over here in the US. I guess with residency, all the other stories that I may have are kind of gross. So it's nothing,
Plenty of those.
or crazy. I think I got, if I ever had any germ phobia or anything like that, I got cured during residency. I mean, I got any kind of bodily fluids on me, and I was like, okay with it. I'm like, okay, what's next? So it's an interesting experience.
Absolutely, absolutely. So let's dive right in. Can you please
Sure.
introduce yourself to our viewers? Tell us, what specialty you're in and where in your in the process you're at. I know you just recently started your own practice, so
Yes, exciting, exciting times. So I am board certified internal medicine doctor, and I'm actually also an integrative physician. I had I'm actually practicing here in Austin, Texas. I pretty much started residency and graduated back in 2012. I was with LSU in Louisiana, and I've moved to Texas back in 2015. So it's been quite a journey for me. And as I mentioned to you earlier, I'm actually for a medical graduate, since I did medical school back in my country in Dominican Republic, and went through all the tests and all the hard sweat, tears, especially with trying to come here to the USA, and be able to land in a residency program, because that's all what we wanted, a good residency program. And it was not easy, but I'm thankful that I was able to actually land in a residency program here. And now, after I've been pretty much employed and working in the hospital and bigger health system, I actually 2 months ago, I've resigned and I decided to start my own private practice. So pretty much the focus with my practice right now, it's mainly towards integrative medicine. I get to do my own hours, my own schedule, and spend the time that I need and I want with each patient.
gotcha. So let's
Yes.
talk about that. How challenging has it been to start your own practice? Because a lot of people are steering away from private practice. So what have been some of the pros, some of the cons, and what made you decide to do private practice instead of continuing to work for somebody else?
Right. I think for the last year, I've been having that kind of, that feeling inside of you, like that kind of itch, like, I want something more. I want something else in life.
Yeah.
I didn't feel comfortable. I mean, I'm very grateful for everything that I accomplished and what I've learned in my previous jobs and also for my previous employer. But I always wanted to have a sense of having more autonomy, more independence.
Mhm.
It was not easy. It's never an easy step. It does come with its challenges. I have met some of my colleagues that really wanted to make this step, and they get so scared and so afraid because you don't have that, that financial stability. You're kind of like going to the unknown. You're like so comfortable earning this salary for several years, getting your benefits and having everything, set up for your family, a steady income. And then you're like, okay, I'm just gonna leave it all and just start fresh and new.
Yeah.
But as probably as yourself that you probably experienced, I took this step kind of like the same way that whenever I decided to come to the US to practice medicine, to residency. I mean, I was going to the unknown. I mean, it's very scary, it's frightening, but I knew that it's something that I needed to do. It was something like a force that was driving me to do so.
Mhm.
I did a lot of soul searching,
Mhm.
a lot of talking with other people that have taken this step, which is very helpful. I mean, if you can actually, if somebody wants to go ahead and go into private practice or create your own business, if you can have some sort of mentor or somebody that you can actually talk to and discuss, it's very helpful. And I actually met wonderful people along the way that kind of like coach me through and help me through this. And I'm like, okay, this is it. This is gonna be, this is gonna be my time. I'm more stable
Mhm.
in my personal life, so I was able to make this big step.
Beautiful. So, how does
Yes.
that work? Do you take out like a business loan and then are you able to? And then the other thing is you're 2 months into your practice. How do you attract
Right.
new patients? What's your avenue of trying to get patients to come to your practice?
Right. So you need to prepare financially. I mean, I did manage to save about pretty much close to a year worth, kind of like of a personal salary, kind of like in savings, that is. And because I knew that I was not going to be able to make money, most of my colleagues had told me, be prepared that if you're going to take this step, first year is going to be extremely hard.
Yeah.
You may not be earning money, but if you're able to at least get some money to sustain your practice or at least pay for your expenses in your practice,
So
then you
much.
can still maintain afloat. Like you might not be able to have a salary, but I'm hoping eventually, since I'm kind of fresh and new on this, that further down the road, I'm able to actually make a profit and have, a salary for what I'm doing. In terms of marketing, it is hard. Um, it's time consuming. It's
You don't even realize it.
stressful.
Yeah.
Yes, and I'm an introverted person. So I have actually decided to, I want to make this work. I feel passionate about it. I love this. I need to, I need to do it. I just need to dive in, take that step.
Absolutely.
um, I had to do more, exposure, going to networking events, meeting people, going to people's offices, just kind of like saying, hey, I'm new doc.
Yeah.
I'm accepting new patients is what I'm doing. And it's quite hard. But I mean, at least with starting your own practice, since you don't have that much patience in the beginning, during my free time, I'm trying to dedicate to doing marketing and, getting the word around and trying to lure patients in,
Mhm.
or getting into social media stuff also.
Yeah, absolutely. So what are the like what made you do your own practice rather than joining somebody else's practice that's already established, that already has a clientele list? Do you see what I'm saying? So what are some of the pros and cons? And you kind of touched upon that, but
Yes.
why not just join somebody, who's looking for a partner?
Yeah, I mean, the partner idea is actually pretty good. I mean, I am actually in an office that is shared with two other doctors, but we are very we're pretty separate. Like there's not a like if somebody's out, I'm covering for their patient. I mean, we try to help each other,
Yeah.
but it's not like we're all the time like partners or covering for each other, or being on call or anything like that.
Gotcha.
The practice is a little bit different. So it would have been awesome actually to have partner up with somebody that, let's say, are willing to like share patients, and that way also you are able to actually grow your own practice.
Yeah.
I didn't have the opportunity. There is, it's good, and it's also, I see that it has a pros and cons. I see the pros: you're able to get more patients and be successful quicker, get on your feet kind of quicker. But I feel the cons is you still going to be under the shadow of somebody else. You
Absolutely.
have to follow what they're doing. They probably have their own set of rules. They also have their own personality. So you actually have to kind of find somebody that actually, you can actually combine forces and actually kind of, help each other and really become like a cohesive team.
And that's not
It's not easy to find.
absolutely.
Yeah,
Okay.
it's not easy to find, but that's why, I mean, it came the opportunity to kind of there was an opportunity to share this office and pay the fees for rent and any other expenses, so kind of worked out for me that way.
Beautiful. So let's talk about integrative medicine. You said
Yes.
that you were practicing that. So tell us a little bit about what is integrative medicine.
Yes, so integrative medicine is actually takes, it's more like a holistic medicine.
Okay.
It takes into account the whole person. We're not just treating the symptoms. We take like a mind body approach. We use alternative and complementary modalities. We use, it's kind of like more some traditional medicine, traditional Chinese medicine. It's like East meets West.
Yeah.
So the main reason why I decided to actually also do this, because I wanted to offer something more to my patients. I
Mm-hmm.
felt kind of like I was always, seeing patients for 15 minutes, prescribing something for a symptom, letting them go. I wasn't good at getting into the root cause of their problem or figuring out why they're having these issues. I do a very thorough, a thorough clinical evaluation, pretty much focusing on their lifestyles, their diet, nutrition, what they do to kind of practice any kind of exercise or anything to kind of help deal with stress, how they sleep. So it's a lot of information that we try to get from the patient, so that way we can actually offer them what we can do. I mean, I'm still practicing some of my allopathic or conventional medicine, as you want to call it, but I also use a lot of evidence-based treatment that is out there in terms of alternatives, because some of my patients, they just don't want to be prescribed a pill. They want to be listened. They want to figure out why they're suffering with some gut health issues.
Yeah.
Why are they having insomnia issues? So I deal with a lot of more chronic medical condition, which is actually kind of convenient, because that's also why I went into internal medicine. But it's more about prevention rather than just, treatment and letting the patient go, right?
Treating the symptoms only and not the entire.
Exactly.
So I'm actually
Exactly.
trained in osteopathic. That's my background. So we do osteopathic manipulation, which is kind of neat to like augment your therapy. Like, yeah, you can prescribe
Mhm.
medications and everything, but to offer that extra little thing that helps your patient feel better, and just it addresses the underlying issues. So I'm a huge proponent of incorporating other evidence-based therapies that will help augment your therapy. And then the other thing is in our society, we don't emphasize the importance of nutrition and,
That's true.
being active. So to empower our patients, to tell them that, that you can be your own advocate by educating them, by letting them know what's going on in their body. That's how we promote health. And I love that. I love the idea of integrative medicine. It should be. That's what true medicine should be, is a little bit of medicine which helps the person be their healthier self.
Yes.
So the one thing that I'm really interested in is it's called direct primary care. Have you heard of this?
Yes, yes. And I've seen a few of my colleagues also doing direct primary care. There has been quite a shift from, the being employed and having the RVUs as a form of payment or getting salary. And I'm seeing more, of course, people shifting away from that and doing more direct primary care.
Absolutely.